and plane of the paper should be at right angle to the visual axis. There are total 38 plates, and first plate is introductory plate for demonstration purpose. 2 to 9 are transformation plates. It is read by both trichromat and color vision deficient person. These are transformation plates. 10 to 17 are vanishing plates. It is read by trichromat person and not by color vision deficient person. 18 to 12 are hidden plates. It is not read by the normal person but read by the color vision deficient person. And 20 to 25 are for quantitative diagnostic plates to differentiate proton and deuteron defects. And so first place is introductory plate, 2 to 9 are transformation plates, 10 to 17 are vanishing plates, 18 to 21 are hidden plates, and 20 to 25 for diagnostic plates for differentiating proton from deuteron defects. If the score is more than 17, it is normal. If it is less than 13, red-green defects are present. This is the interpretation chart of Ishihara color vision test. This column, normal person, and this indicates persons with red-green deficiency, and 20 to 25 are diagnostic plates to differentiate proton and deuteron defects. In case of 38 plate test, if the error is more than 8, it indicates deficiency. In case of 24 plate test, if it is more than 6, it indicates deficiency. And in 14 plate test, if it is more than 4, indicates error of deficiency. Advantages of Ishihara test: it is readily available, inexpensive, and can be used in case of illiterates and children also. Disadvantages: interpretation affected by spectral quality of light, and it screens only red and green but not right-hand defects. It does not grade the red and green defects. Next test is Hardy-Rand-Rittler test. It is similar to Ishihara test, but it can detect all the 3 congenital defects. There are plates with paired vanishing designs in this test. It contains shapes which is in neutral color on the background of gray dots. Total 10 plates are present. Next test is City University test. It consists of 10 plates and central 1 plate and peripheral 4 colors, and the person is asked to choose the closest match to the central plate, central dot. Next type is hue discrimination or arrangement test. Here color samples are present in small caps and they are to be arranged according to their hue, and useful for both congenital and acquired color vision abnormalities. It is unsuitable for children. These are the examples: Farnsworth-Munsell 100 hue test, D15 test, Lanthony desaturation panel D15 test, Lanthony new color vision test. Oh, Farnsworth-Munsell 100 hue test. It is very sensitive, reliable and effective method for determining color vision deficiency. It contains 4 boxes and total 85 color samples are present. 2 pilot caps are present at the end of each box, and they should be arranged in the increasing order of their intensity, and color vision assessment is done by error score. It takes total of 15 to 30 minutes, and it estimates the nature and extent of the defect, and correct arrangement is checked after the completion of the test by numbers on the back of the caps, and total error score should be computed. And if the score is high, it indicates worst discrimination ability, and categorize the defects based on the error axis. In normal trichromatic person, we'll see a circle. In case of severe proton anomalies, spikes are seen in the horizontal axis. In case of severe Druton anomalies, the spikes are seen in the oblique axis. In triton anomalies, it is seen along the vertical axis. This is advanced version of the previous test. Here only 15 caps are present and they should be arranged in the sequential order from the pilot color cap. It takes only 5 minutes. It detects moderate to severe dyschromatopsia. Okay. Lantern test, it is done in case of airway and railway employees to screen the employees. It is a simple test measured to recognize the color light saturation. The subject is asked to name the color of the light signals presented to him. It is done at a distance of 6 meters and total 9 combinations of red, green and white are tested. Speed and sequence of the color presentation plays a very important role in this test. Next, coming to spectral anomaloscope, it is an excellent test for screening, diagnosis, classification and grading of the color vision deficiencies. Types are Nagel's anomaloscope, Oculus, Heidelberg multicolor anomaloscope, NITS anomaloscope, Pickford-Nicholson anomaloscope. Here, it contains biparate field, inferiorly yellow colored field and superiorly, if the scale is 0, green color is seen. If the scale is on the higher side, red color is seen. And person is asked to adjust the upper color in view of the yellow color. It uses Rayleigh equation, that is yellow hue is obtained by mixing red and green colors. Subject matches the lower yellow field by tuning the quality of the red and green light in the upper field, and anomalous coefficient should be obtained. It is obtained by dividing the observer's green-red ratio for the green-red ratio of the normal sample. And the normal value is 0.74 to 1.33. If it is more than 1, it indicates deuteron anomaly. If it is less than 0.6, it indicates proton anomaly. To summarize, for screening of congenital defects, in case of suspected red-green defects, we use Ishihara test or Nagel's anomaloscope test. In suspected triton defects, HRR test or City University test. In suspected red, green and blue defects, above test should be performed. To diagnose and severity of the congenital defect, minimum 2 tests such as Ishihara test or Nagel's anomaloscope, HRR test, City University test and FD15 test should be done. For the occupational purpose, Ishihara and lantern test or Farnsworth-Munsell 100 hue test is performed. In case of acquired defects, for screening purpose, pseudo-isochromatic anomaloscope test and FM 100 hue test or FD15 test for diagnosis and follow-up. To test color vision in children, from 3 to 5 years, HRR test is done. From 6 to 8 years, plate test is done. From 8 to 11 years, plate test or FD15 or Nagel's anomaloscope is done. Thank you. Mm. Mm. Color. No, that red green defects. Mm.